the president had made clear that nobody knew healthcare insurance was this complicated, and the replacement plan that they've come up with, the House Republicans have come up with, is anything but simple. It's pretty complicated. Is there a simple solution to this?
I believe there's a relatively simple solution, but I start off with, we have the most vulnerable population. You have the uninsured, you have at the lowest socioeconomic level, and you need to protect their health care. What we are suggesting they do is drop the expansion down to 100% of the federal poverty level. That will take it from 138 down, and some will come up. Then look at your exchange program to 300% and say we will put in the subsidies to cover that. They have the money provided for it. Right now, the stabilization is $15 billion. They're going to cut that back to 10, leave it at 15, 5 more. You have the funds on top of the tax things to ensure that they can afford the health care. That's simple. And you're covering everybody from the lowest level up to 300% of the federal poverty level. That would take care of the Medicaid issues and everything else.
So what you characterize sounds pretty simple. Let's talk about the bill they're going to be voting on tomorrow. What do you make of it?
Well, I think it's complicated. I think there's some elements that people will find very difficult. They're putting sunsets on some issues in terms of when the expansion expires. The needs will still be there then. So you have that, which the moderates will have some difficulty with, but in the Senate as well as the House. You have the exchange. You have a tax credit, which is complicated. And a lot of these people aren't used to paying taxes, aren't used to tax credits and understanding it. So they've taken some, they've complicated, they're taking up to 700% some of the subsidies. And it's age-based, and age is not the issue, it's income. And trying to do income and age, why not just say it's all income-based? Because that's who needs the money.
So you say you have this simple solution. Have you and others in your industry presented that to the White House, to the Republican leadership?
We are in the process of talking to the Republican leadership right now. The policy and some of the politicians themselves. I'll be in Washington on the Hill and talking to the administration again tomorrow about this, because let's say it gets through the House. We still have the Senate. But let's find something that meets everybody's needs, including the recipients. And so that's really what we're doing. We're talking about it. Keep it just that simple, and we can get it done.
I don't think it would be very controversial to say that politics and ideology might make it hard to find a more pragmatic approach on this. When you talk to politicians and talk to people in D.C., do you get a sense that there's a tension between, okay, here's something that sounds good and we might like to do it, but here's the political realities of what we've committed to and so forth?
I think that the senior people we've been speaking with find this appealing and find it very interesting, and they see it as a possible solution. We have examples and things, a different age group, what it means to them, and different income levels. And so when they see that, and they see that, they understand they have the funding for it. Now you're not meeting the need of eliminating Medicaid or moving it way down, but you are saving some funds. You're ensuring it's being applied against the right people. There are a lot of very responsible people in the leadership that are accepting this and saying, yes, this can work.
But can they bring it to the table and push it through and get the endorsement of those who are leading the effort?
I think we're not going to be able to do anything about it until tomorrow.
Yeah.
That has to play out, win, lose, or draw. After that, if it gets through, we go to the Senate, and then we start to really have some serious discussions.
I have a question. There's this term you sometimes hear in healthcare discussions, talk about reform, patient-centric healthcare reform. And I think a lot of people have this sense that when they're dealing with the healthcare system, it's very frustrating. They deal with a lot of bureaucracy. They don't have a lot of choice in the matter. They don't know what pricing is. They don't know how much they're going to pay for something before they go into see a doctor or a hospital. Are there reforms on that aspect, sort of subsidies aside, that you think should be made so that people could feel they're more in control of their healthcare choices and outcomes?
Oh, I think there's clearly, and people are putting forward systems where people understand what it means to get high quality health care. Now you talk to the average person, I've done surveys of what they think qualifies as a good doctor. Oh, he has great parking. They have good coffee and donuts in the waiting room. Very seldom to hear say he makes me well. So there's an education that's needed there as well.
Being in New York, good parking is an important thing.
Yeah, I understand that.
Joe mentioned how difficult it is for people to feel like they're in control of the situation when there's so much uncertainty. How do you, as the leader of Centene, make plans when there's this big question mark over what happens with Medicaid and our health care insurance?
Our approach is very simple. We're going forward as if things are going to stay normal and consistent. You cannot do the what ifs. I'll let the investors and the politicians do that. I'm going to take care of 12 million people left that we insure and ensure that they get the best, highest quality care. And then we'll adapt once we know what we have to adapt to. I'm not going to allow us to get bogged down in the what ifs.
All right.